Hi, everybody. So thank you so much for those wonderful presentations, both this morning and just there in the afternoon. I think both Kathy and Julia have covered a lot of ground in terms of what's going on for young people and their mental health. So I'm presenting findings from CoSpace Ireland. So just to give you a little bit of background on CoSpace Ireland, we were very lucky that we were able to access instruments from CoSpace UK, and Kathy and her team, they were very generous in supporting getting CoSpace Ireland off the ground in the early stages of the pandemic. So we launched a couple of weeks after the CoSpace UK study, so about 4 weeks into the restrictions in Ireland. We've been doing monthly follow-ups up until around December 2020, and then we paused, and we've been taking interval data collection points from then on. So we did a 1-year follow-up, and then we are currently going back out for another follow-up in September as well. So we don't have as many time points as CoSpace UK, but we certainly have enough to kind of give us an idea of the pattern in terms of young people's mental health throughout the pandemic in Ireland. So it's very similar to this CoSpace UK. It's a longitudinal design. We've had young people and children and adolescents in the study. More than 1,800 parents have taken part on behalf of their children, and approximately 350 young people have also taken part in the study as well. So currently we're tracking around 400 families throughout the pandemic at different time points, and not every family answers at every time point, but about 400 unique families in the data set. So I was thinking today about what would be useful and what might complement Kathy's presentation on the UK cohort. So I'm going to look at some of the changes in child mental health that we've observed through the early stages of the pandemic, talk a little bit about what parents are saying about their concerns during those that peak period in wave 1, look at kind of remote learning experiences and the impact that had on children's mental health, and then just talk a little bit about the next phase of research for CoSpace Ireland. So similar to the findings in the UK, we're looking here at the total difficulties for the children and adolescent cohort. And you can see there the same type of ebb and flow throughout the restriction periods, and when the mental health symptoms, and then when we start to bring back in the restrictions, and then also going back into the more serious restrictions that Ireland experienced in October. So we're experiencing, our young people are experiencing the same type of ebb and flow. I suppose interestingly, what we've noticed also is that as well as the restrictions, these are also time periods that mirror the kind of school experience. So like going back to school, being out of school, and so on. So we think that there's something going on as well for some of our young people around attending school, being out of school, and maybe not having certain pressures associated with it. And for some young people, going back to school can be quite stressful anyway. So, I mean, one of our areas of research that we want to look at is maybe teasing that out a little bit more. But if we look at some of the subscales for the children's mental health, and I've isolated out children's mental health for the purpose of this workshop, we see in terms of conduct, we look at the children there in the blue line. You see that things increased over the first period of the lockdown. Again, things got better during the summer period, and that was kind of maintained as we went into the local restrictions and the more serious restrictions in October. We had similar type of findings for hyperactivity as well. So again, we saw that things increased a little bit over the first restriction period. That got a little bit better, and similarly, that didn't seem to change up until the second period of restrictions in Ireland. But with the emotional subscale of the SDQ, we observed that young people did experience a small increase over the period of the lockdown. Things got a little bit better over the summer, but things started to get a little bit worse during the local restrictions and then the more serious restrictions. And for us, in terms of what we've observed in the Irish cohort, the emotional subscale seems to be where most of the change is happening for our young people. I think it would be really interesting at some point to be able to compare the Irish data with the UK data, because whilst there is variations in terms of young people and their individual circumstances and their family circumstances, undoubtedly there's a piece around the policy level and the contextual piece around how Ireland experienced restrictions and how things were changing at a kind of a societal level that might be interesting and be very different to the experience in the UK. So emotional symptoms were really where young people were seeing the most change, and things like that, getting more upset, having more being more clingy, being more nervous, being more anxious, and so on. So I think it's interesting, and people have alluded to this in previous presentations, that children with SEN really, they were quite vulnerable going into this. And as you can see, they had quite elevated scores on the SDQ as well. And these stayed elevated over time, but also markedly increased over periods of the summertime, which I think is quite interesting in contrast to maybe some of our young people who might be of your typical cohort. So for children with SEN, the summer period may not have been as relaxed as maybe some young people experienced the summer easing of restrictions. And we could hypothesize a number of reasons for this. One being that these were children that were going a long time without supports. And you can see for our children here going back into the autumn when school resumed, some of these symptoms were alleviated. And this could be because a lot of supports started to resume in that autumn period of 2020. So again, children with SEN being left quite vulnerable without supports in the first lockdown and throughout the summer period. And anecdotally, a lot of parents were telling us that those supports really didn't kick back into late autumn, and then maybe not at full drive. So trying to tease apart the data, and Kathy has alluded, there's a lot of data in the coast-based studies. There's a lot of different variables. We had a look at looking at children who were vulnerable, maybe going into the lockdown. So children who had elevated mental health scores on the SDQ measure. And what we were interested in is looking at, was there a relationship between the child's experience of mental health and the child's experience of the pandemic in relation to pandemic anxiety. So Oxford developed a measure of child pandemic anxiety and adult pandemic anxiety called the PASS. It's a 7-item scale that measures both consequence anxiety and disease anxiety. So looking at what is likely to be the outcome of the pandemic, and also if I'm going to catch the disease, how is that going to be if I'm going to get sick or my family is going to get sick, and so on. So we're really interested is if young people who are vulnerable, are they more susceptible to be experiencing anxiety related to the pandemic? So we were also interested in parental anxiety scores on the pandemic anxiety scale as well, because presentation between the child and the parent, and one influencing the other. So, there seems to be a mix up there. Go back here. So in terms of the findings that we found for that, what we looked at was the 797 young people that were in the primary school cohort in the first cross-sectional survey that we completed between March and April. So the results of that we found were that children with mental health difficulties were at higher risk of pandemic anxiety when we controlled for other known correlates of mental health. So we controlled for things like gender, age, having a lower socioeconomic status. 3 of those are examples. We controlled for several different variables. And what we saw, there was that direct relationship between children with mental health difficulties and the pandemic anxiety, letting us know that young people who are more vulnerable going into a pandemic, they're probably more at risk of developing anxiety around the pandemic. And this was true for both subscales of the pandemic anxiety scale, both the disease consequences and the future consequences of the pandemic. And then we did further analysis, and what we found was that parents of children with mental health issues had increased pandemic anxiety, and that in turn increased the child pandemic anxiety. So there was also, while there was a direct relationship between the child's own mental health difficulties and the outcomes on the PASS, there was also an indirect relationship where parents experiencing increased anxiety of who had children of their own with mental health issues, that was also impacting on the children. So again, we're seeing this this bi-directional relationship where it's the parent and the child are really interacting with each other, and we've seen that in the number of the studies this morning as well. So in terms of, sorry, a little bit of mix up in the slides there. So in terms of what parents are saying, so shedding a little bit of light on the status, and as Kathy said, some of the statistics around it, you kind of lose some of the stories that are involved. But we had included a qualitative question in the initial survey, and parents had an opportunity to give us information on what was their stressors during the first phase of the pandemic. So statistically, parents were telling us that their top stressor was their children's well-being, and then behind that was their education, then their work, even when their job was safe, their children's screen time, and that was a big theme that came out from the findings as well. And then friends or family outside the household. So they were the things that were stressing parents out the most. And then in terms of parents identifying their support needs, the top support need they were saying is managing their children's emotions. So both the stressors and the support needs tell us that parents really were tuned in to their child's well-being throughout the pandemic. And this was a key concern of theirs. And then on top of that, we had them managing their child's education. Coming out of isolation was a big issue for people in the first wave of the pandemic, and then managing their child's behavior as well as managing family relationships. In the qualitative comments then, they told us a little bit more about what was going on in terms of those stressors. So we identified a number of different themes in terms of mental health. Parents reported that their children had increased anxiety, that their children were experiencing increased isolation, and some parents were feeling really desperate about that. At school, they were talking about children not being able to complete schoolwork, there being too much work, there wasn't enough school support. There was a big theme and a huge concern about state exams. And I know that's a theme that has emerged in other studies, both in Ireland and the UK. Work and work-life balance, so managing work pressures and managing work in school was a huge issue for parents as well. And then supporting a child with SEN. So a lot of parents feeling that they just couldn't meet the needs of their children with SEN, and that there was a huge lack of support. So 97% of parents in our study of children that had an SEN reported that their services were completely withdrawn in the initial phase of the pandemic. So really that sense of abandonment of parents of children with SEN. And then, of course, we also found that a number of families were doing quite well. So some families were finding new strategies and ways of being together that they found really reassuring, and were building their family resilience. So, I mean, I think it is important to mention that in these studies, there are a cohort of families that just did really well during the pandemic and thrived, and in some ways increased that sense of family bonding and resilience. So just some of the quotes from those comments that kind of shed a bit of light on the themes, which is like the first one there: the emotional and mental health needs of adolescents are completely ignored in the current lockdown. It's been quite difficult to watch young men and women suffer mentally and emotionally when the lockdown extends. And as Julia pointed out earlier, we did experience one of the harshest lockdowns in Europe, and school was really out for quite a long time. Parents worrying about their child not seeing their friends, keeping their spirits up and feeling overwhelmed with schoolwork, and the difficulty of balancing work and a lot of parents demands that job making, and not being able to support their children with schoolwork. And I'm going to talk a little bit about that in the next piece, and knowing that their ability to support their young person was suffering. And then the last one: there has been no supports available for my child who has additional educational needs. In school, she had access to so many resources, and all this has completely stopped. So there really is a whole piece to look at around the children with SEN, because for them, I think it's been a very different experience for many other young people. So finally, we looked at the relationship between children's mental health and pandemic and children's learning during COVID-19, and its relationship to mental health of primary school children. So we were really interested in terms of a lot of the work we do in the lab is around school and school variables and how that impacts on children's mental health. So we were interested in how the experiences of schooling might impact a young person's mental health. So we had a number of school variables within the coast-based study, and we used the child mental health measure of the STQ as the outcome measure. Again, we had the 797 young people that participated, that parents reported for. And the school variables that we looked at were the number of hours that school expected children to do, and we split that into a dichotomous variable of less than 2 hours and more than 2 hours. The actual schoolwork that children completed in terms of hours, and again, dichotomized that: less than 2, more than 2. Having an adult at school that they could turn to for support, having a friend that they could turn to support for, and then the parental ability to support schoolwork. So they were the school-related variables that we were able to look at. So the STQ was the measure for children's mental health, and then we looked at the DAS for the parental measure of mental health, the depression, anxiety, and stress scale. So just to say, in terms of this analysis, we did take a kind of a bioecological approach, just situating that young person in terms of their different systems that support them. And I think a lot of the presentations this morning have really just, spoken to that framework in terms of how we actually view young people and how they progressed through the pandemic. So just some of the raw kind of information coming back around parents reporting on that was that 44% of children were expected to do more than 2 hours a day. So again, these are primary school children. So nearly half the cohort were expected to do more than 2 hours. So that would mean then that 56% were expected to do less than that. We saw 34% of children were actually doing more than 2 hours a day. So a discrepancy there between what was expected and what was actually being completed. 40% did not have an adult support at school. So again, a lot of young people feeling that there wasn't anybody in the school that they could turn, that their child could turn to get additional support. And 48% of children had no friend to turn to for support as well, according to their parents. 30% of parents felt that they could not support the schoolwork. So I think that was really quite stark, that a third of parents could not support the schoolwork. And children with poorer mental health were less likely to do more than 2 hours of schoolwork. So again, a gap there in terms of the learning for young people going into the pandemic with mental health problems and those who didn't. So again, we ran a regression for this, and we controlled for some of the known correlates of mental health, like the child gender, pre-existing SENs, having household income, parent psychological distress, and parent employment status. And the results from the regression indicated that less support from a friend was associated with poorer mental health during this experience of remote learning. So importantly, friendships was a really important factor in being able to get on and feel well. And less ability for parents to provide support to their child with their schoolwork was significantly associated with the child mental health difficulties also. So again, this interaction between the parent being able to support the child is really important. And we did further analysis on that. We ran a mediation, and that suggested that less ability to support schoolwork was linked to higher parental distress, which in turn predicted poorer child mental health status. So again, parents who felt they couldn't cope with the schoolwork were more stressed, and this was more likely to impact on the children's mental health situation. So just some of the key messages coming away from the large amount of data that we're working with is that vulnerable groups are consistently worse off throughout the pandemic. What we're also seeing is that child support systems are central to their well-being during COVID. So their parents, their teachers, and their friends in the first instance. And when the parents can't cope, certainly the child is impacted. And what we are seeing from the qualitative data is that parents are spending a lot of effort trying to buffer their children from the external pressures of the pandemic. Those with pre-existing issues are at highest risk of pandemic anxiety and of learning loss. So those gaps are increasing for those who had pre-existing issues going into it. And supporting schoolwork was particularly stressful for parents. I think that's a very important message for school and policymakers. Just in terms of just adding to the debate about what we're coming here together today to do is just what can we actually do and take from these findings and apply? Well, the first area that we think is important is parent supports. Both knowledge is important, so getting accessible materials into the hands of parents, like through an app or through reading materials or through TV shows, which parents did tell us that they found really useful. And that's why it's really interesting to see Kathy's study running there around get the app with the knowledge for parents, because that's definitely something that parents are looking for and need. But we also know from the findings that practical supports are hugely important. Things like childcare, the support services if you have children with SEN or mental health difficulties, financial supports, and that's something at a policy level that could be looked at. In terms of school supports, teacher care and knowledge in resilience-focused strategies and signs and symptoms of distress are going to be hugely important now and into the future. So I think a real emphasis on wellness plans for schools going into the next year is going to be super important. And then improved supports for that teacher-parent link. I mean, a lot of what we're seeing in the outcomes of the findings would have been easily solved if we had things like how-to videos to support children with schoolwork. Not every parent is up to date on how to do certain types of math or how to critique English essays or so on. So little videos from the teachers about how their content could be delivered or supported for their children would have really helped a lot of parents to cope much better with the schoolwork. And then mental health supports obviously are really important for those young people who aren't doing so well, and that individualized child and family support needs to be able to be easily accessed. And of course, funding is key to all this. So I don't know if the people on the call that have the purse strings are here, but funding, none of this can happen without the appropriate level of funding, and we haven't a great track record in Ireland of that so far.
Jennifer, are you happy to wrap up now? We're on time.
Yeah, that's fine. Yeah, that's great. Yeah, happy to wrap up. So if anyone's interested in the future phase of CoSpace, they can give me an email. So thanks very much.
Okay, thank you, Jennifer. And thanks so much again to